mynews.studio.
Picture this. On a quiet road in rural India, a mother taps her fingerprint to access government aid. It makes you wonder, how did a country of over 1 billion people manage to pull so many out of poverty?
Today's date is August 5th, 2025. The recent figures are remarkable. 415 million people in India moved out of multidimensional poverty in just 15 years. That's from the UN and Oxford's Poverty and Human Development Initiative. But what exactly happened to make this possible? And could something similar work in other countries?
The scale is hard to overstate. Back in 2005, more than half of India's population, about 55%, was considered multidimensionally poor. Fast forward to 2019, and it's down to 16.4%. But what's behind this transformation, practically speaking?
It's not just economic growth at play here. India rolled out targeted programs, things like skills training, expanded healthcare, food security initiatives, and maybe most importantly, digital technology. Let's start there. Aadhaar, the biometric ID system. Over 1.4 billion people now have a unique digital identity. Why does that matter so much?
Because before Aadhaar, a lot of benefits disappeared into the system, lost to bureaucracy or even corruption. With digital IDs and bank accounts connected, the government could send money and food subsidies directly to people, cutting out the middlemen. That's the direct benefit transfer, or DBT system. But does that guarantee the money always reaches the right person?
Not every time, no. But it's a huge improvement from how things worked before. Billions have been saved by reducing duplication and fraud. And the changes didn't stop at cash transfers. Healthcare saw big reforms too. The Ayushman Bharat program now gives hundreds of millions access to hospital care. During COVID, food security was addressed through the Garib Kalyan Anna Yojana, which provided free grains to poor households. But how did all these policies interact with each other?
They really built on each other. Banking access came through Jan Dhan Yojana, letting people actually receive benefits. Aadhaar verified who they were. DBT got the funds out, while health and food programs added a safety net. Still, there's a catch. How confident can we be about these poverty numbers?
That's an important issue. Some argue that how we define and measure poverty, especially on health, can shift the results quite a bit. For example, if you apply stricter health benchmarks, the reduction in poverty doesn't look as dramatic. And during shocks like the pandemic, surveys may miss people who are suddenly struggling. So there's always that margin of uncertainty.
Right. The Indian government points to its use of multidimensional measures, looking at education, health, and living standards, not just income. But the debate is ongoing. How do we really know when poverty is falling? And whether it'll last?
That brings us to the bigger picture. If these numbers are accurate, India's model could inform other countries. What stands out is that technology can make welfare more effective, but only if it's paired with broad-based growth and careful tracking of the data.
Flexibility played a role too. India kept adapting. When something didn't work, policies were adjusted. Other countries can learn from these tools, but they'll need to fit them to their own situations. It's not a simple copy and paste.
Before we wrap up, why do we keep saying multidimensional poverty? Because income alone doesn't tell the whole story. Health, education, living conditions, these all shape what it means to be poor or to move out of poverty.
By tracking all those aspects, India and international agencies are aiming for change that holds up over time, not just better numbers on a chart.
So is what happened in India the beginning of a global shift, or is it unique?
That's what the next decade will reveal. If others take these lessons to heart, millions more could leave poverty behind.
Today we've explored how technology, policy, and new ways of measuring poverty came together to reshape lives, and what that might mean for the rest of the world.
Thanks for joining us as we unpacked India's approach to tackling poverty, from digital IDs to large-scale health initiatives.
Stay curious, keep challenging the data, and remember, progress is possible, but it's rarely straightforward. Thank you for listening. This episode was brought to you by mynews.studio. You can try it now, free of charge.